I'm Jill MacMillan.
I'm Sharon Williams.
And I'm Christina Lanzoni, and we're the audiologists for Penn Medicine, Becker ENT.
So the effects of hearing loss are quite far-reaching. A lot of people in the early stages of hearing loss report fatigue. They're just exhausted in social situations. They're expending so much energy just trying to listen and process what they're hearing, filling in gaps of missed words. And that can often lead to social withdrawal because those situations are just too difficult, so they find themselves just avoiding them altogether. And that's obviously not what we want. So just social withdrawal can then lead to depression, which can then, studies are showing can even lead to memory loss and cognitive dysfunction. So the hearing aid education session is an opportunity for a person to sample hearing aids. It's done after we've already performed the audiological evaluation. So we take those results and we input them into our computer that generates a prescription based on their particular hearing needs. And we program the hearing devices accordingly, and we let them listen to the devices. It can sometimes be an eye-opening appointment because people don't realize what they were missing until they're hearing it again. We encourage people to bring their loved ones to that appointment because it's nice to have a familiar voice to sample and gauge their benefit with. So it's a fun appointment. There's no obligation to proceed. It's just an opportunity to sample what's out there to improve their quality of life.
A PSAP is a personal sound amplification product. It is basically just an amplifier for volume. So if someone says, hey, I can't hear my TV, that might be okay. The other thing is, it is basically an over-the-counter product. So it could potentially miss medical issues or medical diagnosis. As an audiologist, I would definitely recommend before getting something like that, get a hearing test so you know what you're working with or what you need. As I mentioned, the PSAP or a PSAP is an amplification device. A hearing aid, however, helps with hearing impairment. It has computer chips in them that will monitor levels of sound in the environment. It may also have individual frequencies that can be adjusted. So if you don't have a hearing loss in one area or one aspect, and you do in another, the audiologist might be able to go in and program the difference. Also with amplification, with hearing aids, you need a medical hearing test or a diagnosis. So if something is an issue, say earwax, or say a growth on the eighth nerve, or say something that can be fixed with medication, we can catch it a lot sooner.
So a child can actually be a day old before they can have their hearing tested. They're generally screened in the hospital before they're discharged to see if they can detect a hearing loss early. They're tested with what they call distortion product otoacoustic emissions, or DPOAEs. And if a hearing loss is suspected, they may be referred for what is called BEAR, a brainstem auditory evoked response, which measures the response of hearing through the brain. Children can also be tested in sound field, which is what we would do in a booth and do play audiometry with them, generally around the age of 6 months, when they can localize and sit up and respond to sound and voice. And generally around age 2 to 4, we can do them under headphones and get a little bit more specific information from them in order to see where their hearing is. So if you think your child is speech delayed, I would start with a hearing test and a visit to the ENT physician just to make sure that there's no fluid causing the delay. A lot of times if there's fluid in the ears and the child's not hearing properly, they could be speech delayed. So we would do a hearing test and we would perform tympanometry to make sure that the middle ear is clear and that's not causing the issue. I would also maybe have a speech therapist do an evaluation just to make sure there's not another problem. And the ENT can also evaluate to make sure that there's not an issue with the tongue or anything going on within the mouth that's causing an issue with speech delay. And getting a hearing test just to make sure that there's actually not an underlying hearing loss that may be missed that's causing the speech delay is a good idea as well, or if there's any learning disabilities or cognitive issues. Your best bet would be to have them evaluated by an ENT physician and an audiologist to make sure that they don't have a hearing loss. A lot of times the speech delay is related to possibly fluid in the ear, which can cause a child to have a hearing loss. So we would test them, make sure that there is not a conductive hearing loss. If there is a hearing loss due to the fluid, then the physician could maybe do pressure equalization tubes to clear out the fluid, or maybe wait and we would retest them to see. If you have any further questions, please don't hesitate to contact us at Penn Medicine Becker ENT, and we'd be happy to answer any questions or schedule an appointment. Thank you.